Whenever it comes to cathing a male, it is a little different because they're private, their genitalia is different. So now we're going to look at the differences. I have already got my sterile field set up just like before. I've already anchored it and moved everything into the middle of the bed. We have the sterile drape underneath, and I also have this sterile drape around the outside with only his genitalia exposed. My non-dominant hand is going to hold on to the penis. I'm going to pull the foreskin back, and then I'm going to go on and start cleaning. Now, cleaning the male is a little different. We're going to go in a circular motion from the inside out and trash. Grab another one. Begin again, circular motion inside out. You want to do this across the head of the penis without allowing the foreskin to retract into that location, nor breaking sterile technique. So inside and out. Once you're done cleaning, we then go on and grab our catheter. Because we have to go through the length of the penis, instead of going in about 3 inches, we will be going in at 7 to 8 inches until you see urine flash back. So we begin by coiling the catheter up so it doesn't fall out of our hands, and then you're going to tell them to take a deep breath and bear down as we slowly insert the catheter up into the penis. Once we get to the point where we see urine flow, you're going to go in another 2 inches and then blow up the balloon just like you did on the female. So when we talk about blowing up the balloon is the part that extends at the bottom of the penis, just like this. This is why you have to go in 2 to 3 inches more. It helps to secure this into the bladder itself. If we don't progress the 2 to 3 inches, we could inflate this into the urethra and therefore cause serious damage and harm to our patient. So always go in 2 to 3 inches past urine return to inflate the balloon. Once it's in there, this balloon sits at the base of that urethra, where the urethra and the bladder meet, therefore securing it into place. When it comes time to remove it, always deflate the balloon first by holding it with the syringe and pulling out everything. It will completely deflate. And then once it's all the way deflated, you then tell the patient to take a deep breath, bear down as you slide this catheter out. After it's removed, make sure that you educate them that they need to drink plenty of fluids. They need to void at least within 8 hours. If they haven't, we need to look back to see if there are urinary retention, and if we need to bladder scan and possibly recatheterize that patient if they're unable to empty after we remove the catheter. Now, men tendency to have a prostate issue. Sometimes that prostate's inflamed and you need to go around that prostate in order to get into the bladder. We have a special catheter we can use. It's called a Coude catheter. The tip of it is shaped in a C form, and please refer back to the PowerPoint. It actually has a picture of a Coude catheter on it. And this allows us to go in, and that C shape allows it to round around that prostate inflammation and extend on up into the bladder where it should be placed. Those are some troubleshooting things with a male whenever it comes to placing a catheter on them. It is slightly different just because we are going in at a greater length to get through the penis up into the bladder. Please refer back to the ATI videos as well. When it comes to catheterization, be prepared to do it on either a male or female. You never know which one you're going to get. So be prepared and practice this skill at home. Lab time is limited right now, I understand, but in nursing school, I used to practice catheter care by taking a 2-liter bottle of water, 2-liter bottle, or a regular L8 bottle, putting it between 2 pillows, and that was my practice. I would spread the pillows apart to expose the urethra or the bottle and practice that sterile technique of inserting it. It's really just hand movements to maintain sterility is the important part. So keep practicing, and then we will talk about check-offs later on the semester. Thanks.